My name is Cliff Stanford. I'm a physical therapist assistant. I've been licensed in Oregon for 10 years this year. Graduated from Mount Hood Community College Physical Therapy Assistant Program back in 1999. I work in an outpatient orthopedic clinic with 2 physical therapists, and we have a support staff of aides here in this setting as well. I've also had an opportunity to work in other settings, but this setting here is an outpatient orthopedic clinic is what I like the best. Patients are generally at a closer position to getting back to whatever it is that they're doing, like I said, whether it be work or sports and activities. It's a really, really cool field, man. We get to impact people's lives on a daily basis, and it's just a lot of fun. I really dig it. Typically, I try to get into the clinic about 15 minutes prior to my first patient, and it gives me a chance to pull charts and look at my day, even game plan a little bit, maybe make some notes, so that when the patients get here, it makes an easy transition from one treatment to the next. Today I've got about 14 patients on the schedule. So by reviewing the chart with that number of patients, it just makes it a lot easier as I'm transitioning patient to patient as the day progresses. My first patient this morning, Tim, had a total knee replacement, total joint replacement. I think Tim's surgery was about 3 weeks ago. Tim actually has a history prior to his joint replacement. He's had a couple of other surgeries and has really been limited in his range of motion. And one of the things that we really want to make sure of is as this new joint is healing, that he gets as good a range of motion as he has available to him. And so doing things like the leg press, we're working on not only strengthening but improving the flexion or bending in his knee. Scar looks good, bro.
No, he does a good job.
We want to be sure that Tim is as stable as he can be when he's doing normal activities. There's going to be doing some fishing and spending some time on the boat, so we need to make sure he's got that stability as well as the range of motion and strength in his knee. And so those are some of the things that we're working on specifically with him, in addition to just the healing that's going on from that new joint that he's got in there. So when patients come in to see us, their first visit is spent with a physical therapist. And the physical therapist will assess the patient, look at the referral from the physician, and create a treatment plan for that patient. And then as a physical therapist assistant, all of my training is in carrying out that treatment plan, instructing patients in physical therapy, exercises, using modalities to help assess or address pain. And when the patient comes back for follow-up visits, I may get an opportunity to work with that patient. Yeah, let's start off with the ultrasound. Working in physical therapy, we really work hard to provide patient privacy. In an outpatient setting, oftentimes we're working with patients on a lot of therapeutic exercise, but also it includes some manual therapy or some hands-on skills. And so you really have to be considerate of patient privacy, making sure that patients are draped properly. But you also have to be very comfortable with working with patients in very close proximity. So this is Jean. Jean and I have had an opportunity to work together now for a couple months. Yeah. Jean had shoulder surgery and since has lost quite a bit of range of motion. And so we're just doing some what we call joint mobilization, and it's really an idea of going in and manually repositioning the joint, doing a little bit of stretching to the joint capsule. Oftentimes when we're lacking range of motion in the joint, it's because the joint capsule has tightened. And so for this part of the treatment, Jean's really just going along for the ride. She's not helping at all, staying nice and relaxed. So now, Jean, I want you to start helping me.
Okay.
So we're going to come up to the ceiling together.
Okay.
Reach. And so having very good communication skills is important. We want to be sure that patients are a part of their treatment, that they're totally involved in their treatment. Good, Jean. Jean's been doing a home exercise program, and she's been really consistent with that, and I think that's a big part of why she's made the gains that she's made. Let me see, where we started at the very beginning. Yeah, you were at 30 degrees.
Which is what about here?
So you were probably about right there. Almost 80 degrees of range of motion you've gained. Yeah, yeah.
So what's next?
Let's do some strengthening. You're gonna lean over towards your right arm. Now you're gonna, and so there's a trust factor. That's a big part of what we do in physical therapy. To the right. So what we're doing here is just working on getting a little weight bearing through that shoulder joint.
I can do these at home.
Yeah, yeah. Good. I may get to see as many as 17 patients in a day. They're scheduled every half an hour. And so sometimes it gets a little bit busy. We have support staff here, physical therapy aides who can assist us in our treatments.
I do this sometimes too. Oh, do you? They burn.
One of the great things about this field, you know, there's so much interaction with clinician and patient, and patients really become a part of our extended family.
All right, see ya.
All right, young lady. Good work today. You know, that's one of the things that we pride ourselves on, is really connecting with our patients. So Matt crushed his hand between a wash machine and a wall, something like that. And so coming along really, really good. We're going to start off with some paraffin or hot wax. And so we do with the paraffin, what we're really doing is coating his hand in a warm wax. We utilize the heat from the wax, and then it traps in Matt's body heat. And it's a great way to start off if we're going to be doing any joint mobilizations or trying to improve range of motion, also decreasing pain. So Matt, I think Ryan wrote in the plan to start doing some functional stuff today, some lifting with the cable machine. So we may try some of that. I'm still going to get in there and work the joint a little bit, but then we may get into some of that. How'd you rate your pain last 24 hours, 0 to 10?
Virtually none, just real stiff still.
Yeah.
I'm having a hard time being able to grip and hang on to something.
So Matt has to go back to moving appliances. And so a big thing that we're concerned with and that we have to focus on is grip strength, because we want to be able to make sure that his grip strength is what it needs to be as he's moving appliances around. It's really a test of grip strength and grip endurance.
Puffing and puffing already.
Yeah, you know. So this is a great wrist strengthening activity, but you know, it's 10 pounds, and as you go and you begin to fatigue, we want to test and see what is your endurance like. You know, what does it feel like to grip that heavy a weight for this long? Again. And rest. So on your first visit, the strongest that you could squeeze was 24 pounds. Squeeze it! Squeeze it! Today you squeeze 95. So, you know, an improvement of a significant amount. So because we're using a direct current and we're driving that medication through the tissue, use a little alcohol swab here so that if there's anything on the skin, we don't want to drive that into the tissue as well. And I'm going to add an anti-inflammatory medication to the patch. So the side with the medication on is going to go right over that joint that's irritated. There we go. And so this unit here increases the current to drive that medication to the tissue. So we're going to let that run. It's going to run for about 20 minutes. And we'll take everything off, and you'll be done for the day, sir.
Okay.
All right. I actually have a number of roles here at my job. My primary role is clinical, working with patients on a day-to-day basis. But here I also have an opportunity to do some administrative work. I'm the director of sports outreach, so I get out in the community and meet people and build programs out in the community. I'm also the coordinator for clinical education here for our company, and so I design and set up monthly meetings with all the clinicians within the company. She and I have been talking via email, and so she's going to do it on May 6th. We get together once a month to do continuing education within our company, and it just helps us all grow our clinical skills. If we go to continuing education courses, we bring that information back and share it with the other clinicians here in the company. So during my week, I have time blocked out to do those other tasks as well as my clinical tasks. And through the American Physical Therapy Association, I went through a coursework to become a certified clinical instructor. It's a part of the continuing education that I get as a licensed PT assistant.
You're gonna feel it. But the water only gives you as much resistance.
As students come through the program and are doing their internships here with me, we get an opportunity to sit down on a regular basis and communicate about the treatments that the students are carrying out with patients. You know, that's a good example because you're going to run into that.
Yeah.
You know, a patient doesn't believe they're going to get better, so what do you do in terms of monitoring their progress?
I think what I did today was just address her immediate concerns and say, well, here we're seeing some very temporary results. Once those muscles get stronger and used to doing that, you can do that.
And as students go through, give them an opportunity to know, hey, this is something that that can be a part of what I do when I'm out of the formal education program. My first patient of the afternoon is a young lady, Kelly. She's got low back pain, significant low back pain actually. So we've been doing a lot of work to just decrease her symptoms. So how you doing?
I don't feel like I'm eating a lot better.
No. There's a lot of hands-on in what we do, working with patients maybe who've had a back injury, a lower back injury, doing some soft tissue work or some massage is a part of what we do. And so being comfortable with that, at the same time, again, we have to be sure that the patients understand what we're doing, making sure that they're educated as to when we are in physical contact with them, why we are, what our goals are. And so having very good communication skills is important for that very reason. 5, halfway there, how are your symptoms?
Well, I'm getting a lot of numbness in my leg and tingling.
Okay.
So should I be doing that or not?
No. Being prepared to change at the drop of a dime. When patients come in, oftentimes we have a plan for what we want to do with them that day, but sometimes we'll have patients who come in and they're really doing poorly, they're not feeling very good. So being able to on the fly address that and deal with that, and make the patient continue to feel comfortable and confident in our skill level to address their pain, yet continue to progress them through their treatment. Those are things that I think are really key to what we do on a day-to-day basis. 5, and then relax, unless your symptoms get worse. How's it feel? You're definitely upright a little bit better.
Last one, let's go.
Brandy is a young lady that we've been working with for knee pain, and she's going to be going in for an exploratory procedure on her right knee. Our job at this point is to try to keep her as mobile as we can, as strong as we can going into the surgical procedure, because that's going to make the rehab that much easier. So today Brandy did quite a bit of exercise, and we finished up with some modalities for pain, and now I am going to do a taping technique to try to see if we can't knock back some of the swelling that Brandy has in her knee. So another technique that I learned going to a continuing education course after getting out of PTA school. Straighten it.
Straighten it?
Yep.
Are you kidding?
You know, we never like to see that, but it's also part of the job. And so being able to handle that, being able to deal with patients maybe not feeling quite as good as they did when they got here, that's a part of the job too. It does get better. Oftentimes at the end of the day, you can be a little tired, a little fatigued, not just physically from working, but also mentally or emotionally, depending on how patients did that day. But it's all a part of the process. It's all a part of the impact that we have on patients. And it's definitely something that I love, being a physical therapist assistant, and I wouldn't trade it for the world.